Hi everyone, thanks for watching Optometry TV. I'm Kara Moore, joined now by Dr. Cheryl Reynolds. Thanks so much for being here.
Thank you so much for having me.
Okay, so we're talking about a few different things. Let's start off with STDs and STIs and really what's new right now.
So what's new with sexually transmitted disease and infection is that it's at an all-time high in the United States. The rate of syphilis, gonorrhea, and chlamydia, are just disproportionately beyond what it was a couple years ago. And one of the key facts is that you're seeing it more in our younger demographics, our 15 to 24 year old patients. And also too, one of the things that came out just recently published October 9, 2019. So these are new stats or data from the CDC, is that there are more deaths in infants from syphilis than ever before, just exponentially high. So as eye care practitioners, it's important for us, we're on the forefront of seeing these patients that come in with red eye complaints. And a lot of these younger kids may be coming in with red eye complaints, and we think it's contact lens related, but we have to keep on our index of suspicion sexually transmitted diseases. And especially if you treat the patients and they're not getting any better, to work up these patients for syphilis, gonorrhea, and chlamydia. Also too, HIV is also increasing. One of the frightening facts is that 1 in 8 individuals who have HIV are unaware that they have it. So again, it's important if we see any ocular signs, maybe an isolated cotton wool spot, which is an area of ischemia on the retina, that we get these patients tested for HIV and other STDs. And remember, not one disease comes to the party by itself. I heard someone say that there's multiple of them. And so if you're testing for sexually transmitted disease, you may want to test for chlamydia, syphilis, and HIV at the same time, as well as gonorrhea.
So that's something that practitioners really have to keep in mind now with the numbers at an all-time high.
Yes.
What about ocular tumors? Why is it so important for optometrists to really be at the forefront?
Again, we are at the forefront. We're seeing these patients, they would come in probably with benign eye lesions that, again, they have gone to multiple doctors to have evaluated, such as a lesion on the conjunctiva, which could be just an benign lesion, but it can also be indicative of lymphoma or leukemia. And we need to be aware, and optometrist knows, that cancers can affect the eyelids from front to back. So it's from the front of the eye, the eyelids, the conjunctiva, to the back, the vitreous, and the retina, to the optic nerve. And so more importantly, not only diagnosing those conditions, we can save the person's life. So I think the first thing is to save the person's life, get them treated, and then save their vision. So.
And I know you also wanted to talk a little bit about diversity in the industry, and you do a lot of work with NOA. What is the NOA?
Thank you so much for asking. So the National Optometric Association was formed in 1969. It's an organization of minority optometrists. And one of the things that's important in eye care is diversity in eye care. And our patient demographics are very diverse. And so it's important for optometry. And we're doing a great job in having a diverse doctor population. So the NOA, our mission is advancing the visual health, of minority populations. So we are doing our best to increase diversity, working to increase diversity within the schools, colleges of optometry, and within the profession as well.
So that outreach is really important.
That outreach is very important. Disproportionately, minority patients are impacted from eye diseases such as diabetes and diabetic retinopathy, which is the leading cause of blindness in our younger adults. Again, glaucoma, another disease that disproportionately impact minorities, and other systemic disease, high blood pressure, which is at an all-time high as well. Half of the population have high blood pressure or are pre-hypertensive or elevated blood pressure now. Same thing with diabetes. Half of the U.S. population has diabetes and or pre-diabetes, and so a disproportionate number of those are minority individuals. So increasing awareness about the importance of a comprehensive eye exam for early detection can definitely improve their vision in the long run, and not only improve their vision, but save their lives as well.
And that's what it's all about.
And that's what it's all about. Thank you so much for having me.
Yeah, thank you for being here, Dr. Reynolds. We really appreciate it. And thank you all for watching Optometry TV.